right, ladies and gentlemen, I bring to you the second episode of our community give back project in 2026, and this is 8th, 9th, and 10th of June 2026. We are gathered at St. Francis Hospital in Nyenga in Buikwe district. What happens very early in the morning? Patients come in and we do capture their vitals and then give them numbers. And of course, after then we do what we do best, that is oral health education, where we break the myth, break the previous understanding, and then enrich the community with preventive measures. We always believe that when the community is empowered, everything is attainable. We ensure the community is well enriched with oral health contents. From therein, we get our team ready for the camp. We assemble and then divide the various stations. We arrange our donations and then put our medications in place, put our sterilized forceps in place, load the syringes, prepare the cotton, prepare the gloves, the medication, and then we ensure that we are ready for the day. What happens after the oral health education? The patient comes to the waiting line before they enter into the surgery room. After a short while, they will be invited into the surgery where various procedures were performed. And interestingly, this time round, we were doing a number of restoration services. We're also doing cementing. We're also doing some cleaning, and then importantly, we're also relieving people from pain through extraction and other days.
That is from Monday, Tuesday, and Wednesday.
As our motto stands, ensuring healthy smiles for all, we ensure that every patient that has checked in one way or the other, they are always attended to, and those that are not in position, we always refer them. So we used our phones for light because the natural light was not sufficient enough to check through the oral cavity. So after the procedure, the patient passed through the pharmacy where they got their free donations and
antibiotics for
basically we gave them
analgesics for pain. So we had a few moments to interact with the staff of the day and the volunteers, and this is what they had to say.
I'm called Natazi Sarah. Made this camp a success, that we see that the mobilization was okay and people have turned up in a good number, and we see that we have even met our target and surpassed it. So we see that we've really met our target and people have got what they expected to get. It was through the management of this hospital which decided to give back to the community.
I'm one of the members of this camp from St. Francis, Nyenga. And basically, so far, the going isn't bad because yesterday we had over 200 patients, and today we so far worked upon 100. So we are hoping by the end of the day, it will be like the number of 200 still something. I believe the mobilization that was done with great people.
My name is Officer Susan Namulika, working as a hospital administrator. So I take this opportunity to thank you for cooperating with us in this dental camp. The first thing we did to make this dental camp successful, we had to plan. Our planning, we involved every staff in this hospital, and every staff made it that it is mine, owned it.
So they owned it,
They owned it. That's what makes it successful. Then, to make people aware, we made advertise. We advertised. We put the memos in the hospital, in the church, and we had the drive. People went out doing drive, and people picked. Very many people have turned up. Our target was each day 100. And surprisingly, the first day was more than 100.
I am Watanda David Odoy. St. Francis Hospital is a Catholic-based hospital in Buikwe district. with services, a variety of Dental Health Uganda, a charity organization based in Tororo, with the support of our main sponsors being the Smile Star group of dentists from the UK.
Okay. So Dental Health Uganda is a charity organization.
Yeah.
So they give out free services.
Yeah, actually, they give out free dental services to the marginalized. We have people who can't afford dental treatment, talk of the simplest teeth extraction, coming costly, talk of root canals, talk of cementing, talk of cleanings. It has always created a divide with regard to health, receiving health. And we are here to promote equitable health for all. And that is how we have come in to provide free dental services as Dental Health Uganda. So we managed to partner with the St. Francis Hospital, given our backing of the strong support from our partners, the Smile Stars. Yeah, basically we had initially planned to hold a 3-day dental camp, and at least we had budgeted for 100 patients per day. And by God's grace, I've seen all these 3 days, we have seen more than 300 patients. Yes. So we talk of maybe 300 plus, 350 plus, or 400 around there. But the turn-up has been massive, the mobilization has been thorough, and that means that there was a call, there was a critical need for dental services within this area, and that is where we came in.